In my role, currently I'm with a committee known as the Canberra Hospital Expansion Program Committee, which gives suggestions as to what we need to do in this brand new building, which we are building, not from the architects and the designers' perspective, but from the consumer's point of view, which is totally different. I had the opportunity to depose before the Select Committee of Parliament when the ACT was trying to regulate and make it legal for euthanasia in ACT, and that was very interesting.
I was on a very effective committee that was looking at national standards for blood and blood transfusions. The input I had there to a specific piece of work was quite important and had good outcomes.
I think the input that we had on the consent stuff was important. I was able to put forward and work with some of the consumers at Healthcare Consumers to actually look at their experiences with consent. And it was something that none of the doctors were aware of and none of the other administrators. So we were able to shape how consent is given and where it's given and what it takes into account in a very consumer-focused way.
I also get involved in occasional discussions about what we need to advise government on buildings for their new hospital, and also looking at the health literacy side of things. Just getting involved and throwing in my 10 penneth worth.
I've been involved in lots of stuff, particularly with infrastructure, which became a very big passion for me. I think it's incredibly important because hospitals and healthcare centres only get built every 40 or 50 years, and so consumers are going to live with that design, because often what's missing around the table is the actual users, and I think bad decisions get made as a result.
One thing that I'm really pleased at having the opportunity to be involved in was Health Pathways. So Health Pathways is online information for doctors, but importantly, from my perspective, it contains health consumer resources. And I've been able to encourage or increase the number of health consumer resources.
The positive response was when I was on a committee and they actually said, Paul, you're contributing a lot to the industry. So, being able to be welcomed into that, because the people on the committee are all very qualified, very seriously trained, and so it's good to hear that actually that they're glad that I'm there and that I'm helping them out.